Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. In this episode, we're going to discuss the PSR probe, the periodontal screening and recording probe. What is it? It's a probe used to screen a patient to determine if there is a need for a comprehensive periodontal evaluation. It's a very efficient and effective screening. It makes for early disease detection. It helps us evaluate all the sites very quickly. It provides us with very simplified record keeping, and it's a time-effective screening. It provides us with the opportunity to provide patient education and motivation using it as a tool. It's a very consistent documentation, and it should be performed as a routine exam on healthy patients. It can be followed by a comprehensive exam based on the findings. If there's a score of 4 in one sextant or a score of 3 in two sextants, it should be followed by a comprehensive exam, as stated in the American Dental Association benefits of using a PSR probe. So the periodontal screening and recording index is used to assess the state of a patient's periodontal health. This index is a modified version of the Community Periodontal Index of Treatment Needs, the CPITN. I know we have all of these abbreviations. And that particular index was designed to evaluate periodontal health status in a quick and efficient manner versus doing a full periodontal charting exam and assessment. And we all know how time consuming that can be to do on every single patient. It can really help us motivate our patients to seek a full periodontal exam in order to complete necessary treatment for their individualized care plan when it's determined that they should do so. We use the periodontal screening probe for all of our adolescent patients. So our adolescent patients do not receive a comprehensive periodontal exam unless the findings of the PSR screening indicate the need to do so. The periodontal screening and recording index measures both reversible, calculus and bleeding, and irreversible changes, attachment loss. And it's also both a cumulative index and a simple index. Now, to complete a periodontal screening and recording, the dentition is divided into sextants and each tooth is examined. It requires us to have a mouth mirror, a PSR probe, and proper lighting and positioning. The PSR probe has markings with a little ball at the end. So the little ball tip at the end of the probe is a 0.5 millimeter ball tip. And then the markings are at 3.5 millimeters, 5.5 millimeters, 8.5 millimeters, and an 11.5 millimeter. So that working tip is a 0.5 millimeter, and that offsets the rest of the markings. So don't confuse that with your other probes. The ball tip, let's talk about why is there a ball tip at the end? It serves a variety of functions during that PSR exam. It also helps us to detect calculus, detect roughness, and overhanging restorations or margins. You have to remember that this is a screening, so we don't know a lot about our patient when we're using the PSR probe, so the ball helps us find out additional information. You're going to start by walking the probe along the base of the sulcus and record only the highest code for each sextant. So you'll probe the buccal and lingual of each sextant, make your recording, and then move on, recording each sextant. So what do we put for a code? Code 0 means that the color on the probe is completely visible, there's no calculus, we did not feel any defective margins, or any bleeding on probing. Code 1 means that the color on the probe is completely visible, there's no calculus or defective margins detected, but there is some bleeding on probing. Code 2 indicates that the color on the probe is completely visible, there is calculus or defective margins detected, and there may or may not be bleeding on probing. Code 3 indicates that the color on the probe is partially visible, there is calculus and or defective margins in that sextant. There is bleeding on probing or maybe not bleeding on probing, but we've definitely had a change in the pocket depth and there's defective margins or calculus. Code 4, the color on the probe is not visible at all, and none of the other factors matter for code 4. When you have a code 3 or a code 4, a comprehensive exam is required. You also want to add an asterisk in the sextant when the findings indicate an abnormality. For example, a furcation, if there's mobility, recession, a defect, or at least 3.5 millimeters of recession. Just put an asterisk in that area or sextant. So in your documentation, you are going to draw almost like a tic-tac-toe that has the 6 areas and put those numbers in each sextant according to your findings. So in each sextant, you only want to mark the highest code that you observed in that sextant. And then once you have completed the PSR, take a look at all 6 sextants to be sure that your patient doesn't require a full comprehensive exam. Don't let the age of your patient fool you. There are times where an adolescent patient will require a comprehensive periodontal evaluation, and we just happen to use the PSR screening on adolescent patients at our school, but there's lots of offices that use the PSR screening probe in between comprehensive periodontal evaluations. It's just going to depend on the protocols that you have in the offices where you work. We also use the PSR screening probe a lot in public health settings or conducting research when we want to have a benchmark for starting points and endpoints. So it's important for you to understand how this tool works and when to use it and what the findings reveal for your next step. By knowing what the numbers mean, it will help you know what your next step is and if a comprehensive exam is warranted. This is a great screening tool for you. There's a couple things that I'd just like to share with you guys that goes beyond the PSR probe, but the PSR probe is used in a couple of different indices. So let's just talk about the descriptive categories of indices. Now, a dental index, it describes the oral status by expressing specific criteria and clinical observations in numerical values, and that's what we use our PSR probe to do. And this is well defined in your Wilkins textbook. A simple index measures the presence or absence of a condition. An example is the plaque biofilm. This measures the presence of dental biofilm without evaluating the effect on the gingiva. That's a simple index. A cumulative index measures all the evidence of a condition, past and present. The decayed missing filled teeth index is an example, like dental caries. This tells us the historical perspective, so that's a cumulative index over time. And then we have 2 different categories of indices. We have irreversible and reversible. Irreversible just measures the condition that doesn't change. An example of an index that measures dental caries experience, right? Once you have decay and there's a presence of a restoration, that's irreversible. Reversible measures a condition that can be changed. An example of this is the dental biofilm. So the PSR probe is your first introduction to a tool that we use to measure using a dental index. So I just wanted to throw that in this particular podcast. You will learn all about the different dental indices when you take community dental health. And there are a few different dental indices that you will be expected to know really well and we use in the clinical setting. The PSR probe is a perfect tool for you to be exposed to and use, knowing that that would be a tool that would be used in a public health setting or during research when you are calibrated with other people and you are measuring the health status of a population. There are other dental indices that you will use during the program, and you might use different tools in order to achieve that goal. I just wanted to define some of these different indice things, the general categories, the simple, the cumulative, the reversible, and irreversible, so that it helps you to be forward thinking about how these dental indices work when you're applying them in the clinical setting. And the PSR probe is a great place to start. I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.